Hi everyone, now we are going to discuss about types of anemia based on cause, based on RBC size and based on specialty. Let us discuss one by one. Here you can see types of anemia based on cause. In that, the first one, iron deficiency anemia. This type of anemia caused due to lack of iron. And vitamin deficiency anemia, again it is divided into two types, megaloblastic anemia and pernicious anemia. Deficiency of vitamin B12 causes megaloblastic anemia, and pernicious anemia, it is an autoimmune disorder which is caused by poor absorption of vitamin B12 vitamin. The next one, anemia of chronic disease. This type of anemia we can see in the people who has the chronic diseases like infection and cancer. Aplastic anemia, this anemia caused because it is caused because of lack of blood cell production by bone marrow. Aplastic anemia is a type of anemia which is caused by lack of blood cells production due to bone marrow defect. The next type hemolytic anemia. Hemolytic anemia, here in this anemia is caused by RBC. Here the RBC destroyed faster than they made. The next one, sickle cell anemia, and this is a genetical disorder, and here abnormal hemoglobin causes sickle shaped cells, and this is the cause of sickle cell anemia. The next one, thalassemia, is also genetic disorder. Here abnormal hemoglobin formation we can see in the people who has this thalassemia. The next one, post hemorrhagic anemia. Here this anemia caused by acute or chronic blood loss. So this is about anemia based on the cause. The next one, anemia based on red blood cell size. Microcytic anemia, normocytic anemia and microcytic anemia. And these are small size RBCs. Small RBCs, it means red blood cells are smaller than normal size. If the red blood cells are smaller than normal size, so that type of anemia we call microcytic anemia, and we can see in iron deficiency anemia, thalassemia, anemia of chronic diseases. The next one, normocytic anemia. So this here RBC red blood cells are in normal size and but the anemia caused because of acute blood loss, hemolytic anemia, and is there any chronic disease or aplastic anemia. So these causes anemia even though the RBC in normal size. But in iron deficiency anemia, thalassemia, anemia of chronic disease has small RBC. The next one, microcytic anemia. Microcytic anemia, here the red blood cells or RBCs are larger than normal, has more size than normal, and the causes vitamin B12 deficiency, folate deficiency, alcohol related anemia, liver disease anemia. So these are the causes of microcytic anemia. And here we have the special types of anemia: hemolytic anemia, Fanconi anemia and sideroblastic anemia. Here this is an autoimmune or hereditary disorder, and this is caused by G6PD deficiency. And Fanconi anemia is a rare genetic disorder caused by bone marrow defect. And sideroblastic anemia, here the problem is iron unable to form hemoglobin, impaired ability to incorporate iron to hemoglobin. This is about special types of anemia. The first, based on the cause, iron deficiency anemia, vitamin deficiency anemia, again is divided into megaloblastic, pernicious, anemia of chronic illness, aplastic anemia, hemolytic anemia, sickle cell, thalassemia, post hemorrhagic anemia. and the based on RBC size, microcytic anemia, normocytic anemia, and macrocytic anemia. And special types of anemia are hemolytic anemia, Fanconi anemia, and sideroblastic anemia. Thank you all.